Welcome to KSAU Master Talk, the scientific podcast from KSAU University. I am your host, Dr. Nadine Al-Musnid, and we have today our distinguished guest, Dr. Aisha Rehim. Dr. Aisha is a leader in healthcare and AI, serving as the Medical Executive Director at Johns Hopkins Health Plan, where she is also the chair of the AI Governance Council. Today, we are going to explore how AI transforming healthcare, research, and education. Welcome, Dr. Aisha, to our podcast.
Thank you, Nadine. Thanks for the invitation. Looking forward to a very productive conversation and how we can use artificial intelligence in healthcare.
Well, AI now is the buzzword. Can you tell us what AI in a simple term?
Right. Yeah, that's right. I think one of the things we start talking about before we even say what different kinds of AI is to learn what artificial intelligence is. Artificial intelligence is a science of is a computer science branch which talks about behaviors and thinking process which are similar to humans. Things that humans do, artificial intelligence word is used for that. Let's say decision making, thinking, maybe computing at a faster rate. Things that we associate with human are the things that we use the term artificial intelligence for. And then we go deeper into artificial intelligence is that we have two kinds of artificial intelligence. We have a predictive AI, which we call it a more traditional AI, which predominantly has been around for a long time, has been used in the industries for a while. Like, Amazon uses it, other big tech giants use that. And then we have generative AI, which is the recent buzz, which started happening in around 2020 with the advent of ChatGPT and other large language model. That form of AI is generative AI, means it generates new text, new images, new videos, which are novel, means new. And that kind of generative AI is new. And so there has been like in our healthcare as well as in our day-to-day functioning, a lot of people who use the term artificial intelligence, but they can't discern which kind of artificial intelligence they are alluding to, whether it's generative AI or predictive AI. And it's very important for us as healthcare researchers, educators to differentiate between the two different kinds of artificial intelligence. Both are are part of machine learning, but one is different than the other. So,
which one is are using it more in healthcare?
Yeah, so predictive AI is used more in healthcare. And the reason being is it predicts things. It learns from historical data and predicts the new or the future risk. Okay, let's say the risk of heart attack and risk of developing delirium in ICU patients. There is predictive AI models which are still machine learning, but they are not generating new content. So it is predominantly predictive AI that is used in healthcare. However, with the advent of generative AI, now generative AI is used in healthcare in more streamlining processes. Let's say generating a discharge summary. A discharge summary which is sort of novel and new, which is based on all the important areas in the hospital that the patient had his or her medical care taken care of in the hospital, or summarizing documentation. That could be that also involves generative AI. Generative AI is used less in clinical decision support at the moment. There are several pathways that we are working on in terms of using generative AI for clinical decision support, but it's predominantly predictive AI that is being used in the healthcare setting. It is used, generative AI is used in, as I gave an example earlier, in surgical patients in terms of fusing the bones and predicting what would be the risk of infection or bleeding in real time. That's where one of the areas of generative AI is used. Now, in medical or healthcare industry, there are some areas where these both kind of technologies are used together.
Merging together. Yeah.
Right. And that's where it's kind of difficult to distinguish whether they're using predictive AI and generative AI. And part of job that I do is working or as a chair and lead for Executive AI Council is that figuring out what kind of artificial intelligence is used, and also and I've realized in a lot of cases they could be both used together. They could have underlying predictive AI algorithms, and then they sometimes use generative AI on top. This I have seen that as well. So it is important to understand both of them, but the risks in terms of AI governance are sort of similar. So from that standpoint, we have to evaluate both of the algorithms and be mindful of that.
Don't you think we will have a third name of or third technique that merge both of them with a new name?
It is possible. Anything is possible. I never say no. But for right now, they're calling both artificial intelligence, and that's why this is the place where both terms kind of merge. It could have predictive AI, it could have generative AI, but sometimes what is also happening is that basic decision trees as well as basic algorithms that are not using machine learning at all, basic yes and no questions are also now being pushed as in the industry as AI. And so that's where we have to figure out if that's what it is. We should not call it artificial intelligence. But everybody just now, the same company that has been using same technology for years is calling their product artificial intelligence. So we have to be mindful of that as well.
Right. It's great using the AI in health care, but ethical consideration, it's an issue. What is the top issue when it comes to healthcare using AI?
Right. So you brought up a really great point, and a point that is of really bigger discussion, which is happening in the United States and around the world. Ethical considerations in AI is one of the reasons that artificial intelligence is not embraced as we were expecting it should be. The healthcare practitioners are reluctant in terms of embracing artificial intelligence because of those ethical concerns. One of the ethical concerns is what is the bias in AI models? There has been a lot of lawsuits recently about talking about artificial intelligence bias and how that can affect patient outcome. And providers and practitioners are concerned about that. So when we work on developing models, we make sure the bias is taken care of or at least mitigated. And there were several different techniques to do that. That's one aspect of it. Also, I think in terms of regulation, we have general guidelines, but we don't have any strict standards as to how the AI should be regulated. But there are certain frameworks we can follow and start off from there in our organization, like Coalition of Healthcare AI standards, which are based on National Institute of Standards and Technology standards, which basically explain the transparency, reliability, fairness, bias, usability, unintended consequences. And at heart of all that is data privacy and security.
That's an important issue.
Yes, exactly. That is very important. That data privacy and security has been under threat in healthcare organization. We recently saw in our Change Health situation that happened in the United States. And that exposed a reality that if data and privacy and security is not taken into consideration, the more artificial intelligence is used, the more that we are at risk and vulnerable, and then increase the risk of our members and patients that we take care of. And so within an organization, I think one of the things that could be done to improve this ethical consideration is to educate and train our employees and our patients as well as our educators on what artificial intelligence is, what could be the ethical consideration, when they should be using, when they should not be using, what should go in those search engine, what is protected health information that should not be going into those large language models. And then we need to have a strong governance principle and artificial intelligence policy and roadmap for the organization to make sure when we use these what's called these large language models and AI in healthcare, our patients are safe, and we have some standards and guidelines to follow.
Do the patient knows about this standard guideline?
Do the patient know about the standard and guideline? Good question. I think what ends up happening is that a lot of organizations are now incorporating that we will be using these processes in their privacy policy statements, in their patient handbooks, in all the consent forms that they sign. And then they are also communicate with the members and patients in terms of newsletters, in terms of, any community relations and marketing, that artificial intelligence is being used and has been used. And we are taking care of data privacy and security. We are following all the ethical consideration because it is a matter of educating public and the members that you're taking care of. If they're educated, then they're going to be able to be your partner as opposed to your working against you. So I think there are several ways that could be communicated and to build trust in AI systems or AI software that they're going to be used in the organization.
Well, digital transformation, it's a key in Vision 2030 in Saudi Arabia. And we are making great advance in this area. How do you see AI can help achieving the goals toward Vision 2030 in Saudi Arabia?
That's a great question. I mean, this is a great vision for Saudi Arabia, and it can, it is transforming Saudi Arabia as we see it. Digital transformation is going to be the infrastructure for artificial intelligence. Once we have the digital infrastructure, we can explain in simple terms that we have a digital infrastructure, then we have AI system models and sciences that are on top of that. And then we build up the application layer that we can use those applications at government level, at school level, at university level to build a specific AI application that could be customized to your organization. Okay, so if a scientist at your organization decides to use artificial intelligence, the digital infrastructure is going to help that. Digital infrastructure is going to help that, and artificial intelligence, once it's developed and become part of that infrastructure, is going to advance and expedite the things that we are doing to achieve our goals for Vision 2030. Taking care of our patient, improve quality, improve health of our patients in all areas of Saudi Arabia. And so I think it's very important that we bring in AI experts at this stage, where we have digital transformation happening and already happened in a lot of sectors, and build AI on top of it, and then help enable and reach the goals, the eventual goals for Vision 2030 to empower and deliver the quality healthcare that the Crown Prince has visioned for Saudi Arabia.
Well, moving forward, how do you see collaboration between KSAU scientists and a global institution like Johns Hopkins?
That's a great question. And what we are thinking is that in terms of collaboration, we're going to continue working from person to person. And we're going to continue developing some strategy, vision, partnership, as well as building a roadmap, building policy for the organization, building some training programs for the scientists, as well as collaborating with the other key stakeholders, like SDAIA, which is Saudi Data and Artificial Intelligence Institute, and bringing them to the table and figure out how we can use their newly released large language model platform like Alam to help us move the university forward, and how can we incorporate that and help it and help our scientists, students, and physicians leverage the power of artificial intelligence to achieve that goal. So I think this collaboration could be multi-step, and I will be hopefully involved initially in the designing this collaboration and delivering on it, and then we can consider greater collaboration of the organizations as well.
That would be great. I think this is a great idea when we start one person to one person research, and then we move forward.
Yes, exactly. That's faster outcomes. I think that would be the way to go.
As an AI specialist in healthcare, How do you see this all AI advancement will change the way how we train our future health provider?
That's actually a great question. And the way I look at it is it's sort of two-tier. One is AI, how to use artificial intelligence in terms of you having the educator, teaching the educators, our scientists, how to use AI to teach better science, to teach better, to learn and teach better ways of teaching. And because our educators that are actually teaching the new generation of physicians or providers or dentists or pharmacists are not well equipped in the technologies that they need to train them efficiently. And if you see other industries like business, retail, or other fintech, they are much advanced in terms of training their upcoming generation. So we have to do a better job in training them. And so artificial intelligence can play some role in that. If they can figure, the ChatGPT can be used to design course and curriculum and improve the ways of teaching. And that's one way of doing. And then incorporating artificial intelligence into organization-wide strategy where you can, have them work on the project that they want to work and how they can use artificial intelligence to improve productivity, improve patient outcomes, and in different areas of healthcare in general. Population health analytics is another place where artificial intelligence is used a lot. SDOH determination, social determinants of health, is another area that is used a lot. Health equity and artificial intelligence, intersection of that is very important because that is an area where you can use artificial intelligence to improve the disparity and improve healthcare in the in areas which are underprivileged and cannot afford the care. There's an interesting project that is going on at KSAU where your researchers are working on trying to build a model that is going to precisely help them with that. I don't want to give the details out of what they're working on, but they're definitely working on getting help to patients who are in remote areas and to get the care that they need using artificial intelligence, large language model, and we can certainly precisely help with that as well.
Yeah, I am a proud member of the National Guard Health Fair, and I know how advanced we are in this area.
Exactly.
Let me ask you the question that scares everyone, and I'm sure you heard it a lot. Is AI going to replace us? Is AI going to replace the researcher and the scientist?
Right. That's a question that is very common fear among researchers, scientists, physicians, doctors, nurses, you name it. And it seems like they think that artificial intelligence is some kind of robot because of the Hollywood movies that we see, that they're going to come and kill us and take over our jobs. It's not true, at least for now, that we know that artificial intelligence is not that developed and autonomous to completely to replace us. And we as physicians and nurses are always the last one to adopt any new technology because of fear that it is going to replace us. Artificial intelligence is here to augment our work, augment us and our work, and also make us more efficient, and also give us the time back that we have that has been taken from us by doing all these computerized documentation and filling out paper forms and all whatnot. And artificial intelligence can do that for us. They can fill out form. They can do ambient scribe to listen to us and generate summaries and do discharge summaries and progress notes. Yes, there needs to be a human at the end of it, but artificial intelligence can do the heavy lifting, so we can spend more time with the patient and we can do actual patient care that we were actually taught to do in the medical school, because we soon realize as soon as we go into medical practice that we have to look into computer and fill out more EMR and paperwork than we actually look at our patient who deserve our more of our attention. I always say that artificial intelligence is not going to replace us. It's not going to replace physician, doctor, nurses, or provider, but it is going to replace those physician, providers, or nurses who are not using AI. So AI, doctors, nurses, and providers who use AI will be replacing the ones who don't use AI. So
I like
understand
this
that
statement,
is very
yeah.
well coming up.
So, what's your final recommendation for all the health providers, scientists, and people working with science technology?
Yeah, it is to really embrace new technology in a way which is following the ethical considerations and guidelines, and see if that technology can help you improve the outcomes, improve the quality of care, improve the the time that you spent with the patient. Then you can achieve the outcomes that you like to achieve by using the technology. So embracing the technology would be good. And just keeping your eyes and ears open as we learn more about it and as we implement it in our workflows. We just have to be mindful of what could be bias, what could be discrimination that are in these that could be part of this technology. But at the same time, we can help to remove it and help improve its implementation.
Thank you so much, Dr. Aisha. It's been a pleasure having you on the podcast.
Thank you, Dr. Nadine Al-Muswid. I appreciate all the questions and love interacting with your faculty member. They're
It's a
very
pleasure for us.
Intellectually motivated and look forward to continue to work more with you.
Thank you to our listener for tuning into the KSAU Master Talk. Stay tuned for more episodes as we dive in more advanced in science, technology, and healthcare.